COVID has become ubiquitous in our lives. It's there everywhere. Some patients who have been infected with COVID in the past have new, recurring, or ongoing symptoms for more than 4 weeks after the infection. The syndrome appears to affect those who have mild as well as moderate to severe COVID. Well, these extended COVID symptoms are collectively called long COVID. These long haulers have a wide range of physical and mental symptoms. Let's touch upon long COVID in this short video. What are long COVID symptoms, how to recognize and treat them, and most importantly, ways to prevent the long COVID after your acute COVID illness. Let's discuss. Hello and welcome. This is Dr. Arun Naik, a neurosurgeon and a health blogger. I work in a large tertiary care hospital at Bangalore, which is now a dedicated COVID hospital, and I'm involved in the neurological care of these patients. If you're new to the channel, please consider subscribing to DocLogs. We use long COVID as an umbrella term for a wide range of health consequences that are present more than 4 weeks after a COVID infection. Medical community is still learning about these post-acute symptoms. However, it can be difficult to distinguish these long COVID symptoms from symptoms that occur for some other reason. Now, who are at risk of developing long COVID? Well, older people, women, and those who have had 5 or more symptoms in the first week of becoming ill with COVID-19 were more likely to develop long COVID. Also, people with asthma, heart disease, and diabetes are more likely to develop a long COVID. Smokers can have those breathing related long COVID symptoms. Let's see why long COVID happens. Effects of COVID-19 have been documented in almost all organs, including heart, lung, kidney, skin, brain, nerves, and mind. In the heart, there may be myocarditis or pericarditis, which is inflammation of heart muscles or heart's covering. One can have heart attacks or cardiac arrhythmias, meaning irregular heart beating. We also see dysautonomia, meaning sudden change of blood pressure on change in body positioning. There may be those notorious blood clots involving lungs called pulmonary emboli, which can be fatal, or brain strokes, which again can be either arterial stroke or venous strokes. We also see in brain a condition called encephalitis, which is delayed viral infection of the brain. In the spinal cord, there may be Guillain-Barré syndrome or myelitis, which can cause paralysis of limbs and breathing difficulty. There may be kidney failure or new onset diabetes and thyroid illness. What are long COVID symptoms? Difficulty thinking or concentrating, called a brain fog. Many patients complain about this. They just can't take up a new task and their mind becomes totally a blank slate, they say. Some of my patients have difficulty in breathing and they feel suffocated, especially wearing a mask. They also may have an irritating cough. Painful joints or muscles is seen in some, especially after a long walk. Some patients have chest pain, palpitations, headache, feverish feeling, and feeling dizzy. One symptom which bothers some is the sensation of tingling numbness in extremities or palms and feet, more common in diabetics and smokers. One symptom which I need to stress more here is that notorious loss of smell and taste, which is an unmistakable symptom during that acute COVID illness, which can linger on for many months after the illness. This is due to the fact that the virus gains entry into your body through those olfactory nerves, that smelling nerves, as it has a very high numbers of virus gateway, those ACE2 receptors. And this virus selectively damages those nerve endings, leading to long-standing loss of smell. This is the most irritating and most disabling symptom, which leads to loss of appetite and weight loss. It may last a few weeks to few months depending on the damage caused by the virus. Last but not the least, those mental stress and depression, anxiety, which can last several months after that acute illness. I'll make a separate video on mental health during COVID times sometime later. How long does it last? We are still learning how long the illness lasts, and it can vary in different individuals. It's common for it to last 5 months or more, and there are separate reports of it lasting 12 months or more. Is long COVID contagious? No, long COVID is not contagious. Long COVID symptoms are caused by your body's response to the virus continuing beyond the initial illness. Still continue to wear mask. What is the treatment of long COVID? Well, depends upon what is the issue. If it is heart issue, then you need to consult a cardiologist and find out what the issue is. Treatment will follow. If you have symptoms of brain stroke, well, you reach the nearest stroke ready hospital without wasting time, so that your neurosurgeon can assess you and treat you accordingly. For all other minor symptoms, contact your physician, who will be your best bet to treat those. How to cope up with long COVID? Friends, I have some suggestions and advice which I give to all my patients. Number 1, give time for yourself. Plan for your day, what you're gonna do, and don't overexert yourself in the initial period. Number 2, don't try to do everything. Prioritize your work into most important ones and less important ones. Try to break those difficult tasks down into smaller chunks and alternate those easier and harder activities. Maybe you can share your tasks with your friends and co-workers. Number 3, take frequent short rests between the tasks. Take a stroll and breathe deeper and improve your oxygen and get back to your work. Number 4, if a particular activity makes you feel breathless, keep doing the same over and over again to get stability. This way you will develop good strength over a period of time. Number 5, get back to fitness mode. Try to gradually increase the amount of exercise you do. Try going for short walks initially, or do simple strength exercises and build from there. There should be some improvement over a period of time. Socialize using social media. Connecting with other people can help you feel happier. Make sure to keep in touch with family and friends. It works. Having a daily routine can be good for your mood and sense of stability. Always stay active and start exercises which will help release those endorphins, those feel-good hormones, which will improve your mood and memory. Many of my patients tell me that yoga helped them immensely to get out of this long COVID symptoms. Importantly, control your pre-existing diseases. If you are diabetic, make sure that the blood sugars are well under optimal control. If you are an asthmatic, take those inhalers on time and prevent a spasm. If you are a hypertensive, take your medications on time, and of course, limit your salt intake. Lastly, be moderate with your alcohol and smoking. It's seen that alcoholics and smokers will suffer more from long COVID symptoms compared to non-consumers. With that, friends, we have come to the end of this video. Thanks for watching and hope you found this video helpful. If you liked it, give me a big thumbs up as always you do. Share this video with all your social media circles. let it benefit all. If you're new here, please consider subscribing to Doclogs. Don't miss my other videos in the COVID series, especially on COVID vaccine, as vaccine is the only weapon we have with us against this pandemic. I'll be back with another equally interesting doclog very soon. Till then, feel awesome, live awesome, and take good care of your health. And yes, get your vaccines ASAP.